Good afternoon. I'm Dr. Deuk Majin. We're here at the Surgery Center Viera, Deuk Spine Institute, getting ready to perform a Deuk laser disc repair on a lumbar disc, L4-5, for a herniation in a patient who has back pain and left leg symptoms. All right, you can see from the x-ray that we're aiming for the L4-5 disc. Our patient is mildly sedated, but still awake. How you doing, buddy? You okay? All right, so this surgery we're going to be fixing one disc, one and only one. Shot? Yeah, no problem. We're not even at the foramen yet, but we will be soon. So our aim is for the L4-5 disc, and we're going to access the disc transforaminal. Come off. Yeah, shot. And what that means is we're going to go through a natural opening that's already there. This way there's no need to remove any bone or ligament from the spine. It's a natural opening. We're going to take advantage of the fact that that natural opening is right here where the herniation is. Lay still. You're doing great. Dr. Deuk here.
You okay?
And we're going to access the herniation through this natural opening. The name of that natural opening is called the neuroforamen. Shot? That should be it right there. Yep. Shot? 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 All right, so we're right at the back of the disc. Let's get an AP view. So I'm going to change my x-ray view from a side to side, Coker, and I'm going to try to look. Well, we're okay, Luis. Yeah. We're going to look front to back. There you go. Look at the tip of the needle. Jordan, show our audience the tip of the needle. Henry, let's go back to the x-ray here. I'm going to show you the tip of the needle. See the white arrow? That's showing you the tip of the needle. Now, show them the pedicle of L4, the circle. Yep. Show them the pedicle of L5. See the circle? And if you draw a line between the middle of the pedicle of L4 to the middle of the pedicle of L5, that's where the disc starts usually. Okay? And that's where we are. All right, let's go back to a lateral view. And we use the AP and lateral views of the x-ray to guide the surgery. Is he comfortable? Is he awake? You awake? All right. How long have you had your back pain for? How long have you had your back pain for? How long?
How many months? October 20th. You said 2021.
So a couple of years?
Yeah.
All right. Maybe a year and a half. I think he's had pain longer than that, but he's had back pain. Let's just say, yeah, 1.5 years, all right? Now, when I asked him, where is your back pain, he said it's right in here, okay? And when I looked at his MRI, guess what? There was a herniated disc right there. It was darker. You could see it at the bottom of this broadcast on the screen. Look to the bottom right. You could see the MRI, and there's actually an annular tear in that disc on the left side, and the jelly has squeezed through the tear, and it's sitting in the tear causing back pain. That's what we're here to fix. Okay? And so we're going to get rid of that pain today.
That does sound like a finger.
Are you comfortable?
Are you doing okay? Are you having any pain in your legs?
No, we're away from the nerve root. So again, we're approaching the bad disc from the side, going through a natural opening. Are you comfortable? Are you comfortable? He's watched too many. He knows what's coming. He's upset. What did he say?
He can't speak too well through the mask.
Oh, we'll take the mask off for a second.
We'll take the mask off.
Are you comfortable?
Yes.
All right. How long have you had back pain for? How,
October 10th, 2021.
so before that, October 2020, you never had back pain in your whole life before that?
Just a few episodes because of the bulging disc.
No, no, before that date, you never had back pain before that, or did you have back pain intermittently?
Yes, because of the bulging disc.
Yeah. All right. Are you comfortable right now?
Yes.
All right. How bad is that on a scale of 1 to 10?
What number?
Well, that was like 10 more.
10.
10? Is that where you get your back pain? All right, good news. We found your bad disc and we're going to fix it for you. Just like you've watched all those people on videos from Deuk Spine, we're going to fix yours. Okay, Jordan, show them the x-ray. Henry, go to the x-ray. So let's show them the tear in the back of the disc, yes. The dye, the black stuff sitting in the tear. And then look how it leaks out behind, and that's the herniation as well. That's the mushroom cap part. Very good. Okay. Let's go with a lateral x-ray. Beautiful. You can see the guide wire in the disc. We're going to take the needle out. Remember, don't pull the guide wire out when you take the needle out. Sometimes the needle grabs the guide wire and can pull it out. 7mm incision. Whoops. Needle on the floor. It's a good thing we don't need that anymore, huh? We're going to come down with the dilator. Okay? You can see we're not destroying or damaging anything inside. We're literally spreading fibers. You guys know what fibers are, right? If you look really carefully at your clothing, you'll see that your clothing has fibers. That's because it's cotton, and the cotton fibers, you could look carefully with a microscope, you'll see the fibers. All right, shot. This is the fascia. Let's give a little more numbing. So the skin has to be cut because it doesn't have fibers, but the tissues below the skin, like muscle, is made out of fibers. And the dilator literally spreads those fibers open. Can you hear me, Major Tom? All right, so we're putting a little numbing medicine, or as we call it here, num-num, to make it more comfortable for the patient. So far we've lost 2 drops of blood. Shot. I'm advancing through the fascia. Now I'm at the herniation. I'm literally pushing on the herniation. I could feel it. And he can feel it, but he's asleep. So we're entering the disc herniation through the herniation. This is the beauty of the surgery. We're not damaging his disc at all. We're actually entering through a tear that's already there. Now, there's not supposed to be a tear, but that's what a herniated disc is. It comes from a tear, and he has a tear. So we just went through the tear, pushing the herniation back in to the disc, and we're going to remove it from the inside of the disc. Shot. I could feel pressure inside his disc. I could tell that there's inflammation. That should be good. It's pushing our tools out a little bit. So we're just inside the disc. We're just inside the tear in the back of the disc. And our tube is sitting in the middle of that tear, and we look around, we can see the tear all around the tube. And now we're going to use the laser to clean the tear and eliminate the back pain. Get rid of it permanently. This is not a temporary fix. This is a permanent fix to back pain, neck pain. If we were operating in the neck, it'd be the neck pain, but we're operating on the back. All right, so now we're inside the tear, and if you look around, you can see the tear and the herniation all around us. There's part of the tear right there. You see that?
Yes, we do.
Okay, so we're going to get to work. For those of you who have not watched these surgeries before, the blue is a dye that we use, and it stains onto degenerated nucleus pulposus, basically the herniation. There's nothing else, huh?
Lysol, please, thank you.
There's nothing else in here that stains blue besides the nuclear material. It specifically stains the nucleus pulposus. And not normal nucleus pulposus, abnormal nucleus pulposus. Abnormal nucleus pulposus, of course, is degenerated acidic nucleus pulposus. You see a little bit of calcification, the gold stuff, little flecks. That's an indication of the age of the injury. It's at least a few years, greater than 6 months in my opinion, from what I've seen. Fresh, young herniations don't have calcium. It's just ones that have been around for a while that do. By the way, the blue fiber is the laser fiber, and the blue is a plastic coating over the laser. We are inside the annular tear right now at L4-5 on the left side. You could see the annular fibers, the white stuff, are swollen. Swollen. Edematous, we call it. And tissues that have edema are swollen because of what's called inflammation. So clearly there's a lot of inflammation happening here in this disc. Of course, the reason there's inflammation in the disc is because it's injured. It's been damaged. And he keeps damaging it. Once you've damaged your disc, it's very easy to re-damage it over and over and over again. And that's what people typically do. It's a scar tissue right there. You can see the calcification. That's not normal. If this was a normal annulus, it would not be golden like that. But this is an inflammatory area. This is where the back pain comes from. By the way, we just did a discogram and verified his back pain is indeed coming from this disc. It was a 10 out of 10. 10 out of 10 means severe. And concordant, C-O-N-C-O-R-D-A-N-T. Concordant means that's his typical pain he gets every day. It's important that you verify the pain is a typical pain, because obviously you don't want to treat pain that isn't typical, because it could be pain you're creating. All right, any questions from the audience?
No current questions, but we do have a comment from Jalissa on Facebook, and they commented, hello.
Oh, hi, Jalissa. Welcome to our live stream of spine surgery. This will be a quick surgery because it's only one disc, and it's the L4-5. So we'll be done in 5 minutes, which is good because we've had a long day. And this one is going really well. A lot of scar tissue right here. Okay, let's go ahead and run for the audience the video showing how does a herniated disc actually cause back pain. What's the mechanism by which that happens?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. We're just here debriding the annular tear at L4-5 on the left side. I feel that this is sufficiently abnormal. This is what's causing his symptoms. We've already verified that this disc is the cause of his back pain because we tested it with a discogram. You can see lots of scar tissue, this white stuff here, and you see the gold color. That means it's calcified, meaning that the inflammation has been going on a long time. He has a little vein right there and a little bit of epidural fat that's bulging, but we're just about finished. You can see the end plate over there of L4, and I just want to make sure we get everything here. He's traveled a long distance. I want to make sure that he gets the very best care. 1 minute left, I think. The good news is his disc is relatively healthy. There is a lot of scarring from chronic inflammation, but otherwise the disc looks pretty good. Certainly seen worse. Okay, well, that should do it. There's his nerve right there. You guys see the nerve?
Yes, we
That
do.
white thing kind of hidden in the fat. You see how there's a, Jesus, you're pulling on the drape. You see how there's a lot of fat around the nerve, guys? The little yellowish color? Every one of those glistening dots is a fat cell. You see the nerve uses fat for energy. Nerves are very metabolically active, so they need energy, and that fat around the nerve serves as a padding or cushion, and it also provides energy. So that's it, that little hole. Now, just to give you an idea, this guy asks a lot of questions, so I want to show him. This fiber is 1 millimeter, okay? So look how big your hole is. Maybe 2 or 3 millimeters at most. That's it. That's the laser surgery doesn't make worse holes. It actually just cleans out the material, preventing it from healing. We're done. What?
I have a little bit, probably. Over here, some.
Great. Any questions?
Please, thank you.
Now, did we show the video on how the Deuk laser disc repair works?
Not yet, no.
Let's do that.
Okay. And no current questions.
Great.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. Now you've seen how the Deuk laser disc repair works to clean the annular tear through a process called debridement with a laser, and then also to decompress the nerve root. So let's take a look at the incision. 7 millimeters. That's it. 1/4 inch. Band-Aid. We lost maybe 2 or 3 drops of blood the whole surgery, and we're finished. All right, hope you've enjoyed the surgery. I think we could wrap up the broadcast at this point since there's no questions. Good job, Henry.
Thank you. Oh, we just got a question. It is from Rhonda Walters on Facebook asking, where are we located?
Oh, Rhonda, we are located in Florida, right near where SpaceX is, as a matter of fact. We watch the SpaceX rockets launch all the time. We're located on the Space Coast, the east coast of Florida, by NASA, about 10 minutes away for NASA. Yeah, you fly into Orlando, and we're about 40 minutes from Orlando, due east. Any other questions?
That is it. No current questions.
All right. Have a wonderful day. We'll see you all on next week on Tuesday.